Hey friends, welcome back to the WellMind podcast. I have been away from the platform for a little while this spring, but I'm back and I'm so excited to share this episode with you. If you are new to the WellMind, then thank you for joining us. And if you're a returning listener, I also welcome you. Thank you so much for spending your time with me today. The WellMind is a space for meaningful conversations about a broad range of wellness-related topics, and this episode is a beautiful example of that mission. Elizabeth DeBolt is a professor and researcher from Liberty University, and she has really invested herself in the topic of maternal mental health for a number of years now. I'm going to share a little bit about how Elizabeth and I first connected as we open up our conversation in the show, but I do want to highlight the organization CAPS, the Christian Association for Psychological Studies, that I was able to get connected with this past academic year. And that's where Elizabeth and I met. As a counselor, educator, and clinical counselor, I am always seeking out solid, evidence-based research and resources. I'm also keenly interested in the practice and process of Christian integration with mental health. The Christian Association for Psychological Studies has been so refreshing for me in both of these areas. As an organization, they emphasize the importance of rigorous scholarship, and they hold to the rock-solid truth of the gospel. So I look forward to growing my engagement with this organization, and will hopefully be featuring some future guests on the show that are also connected in with CAPS. Now, let's get into my conversation with Elizabeth. In this episode, we explore the important topic, the critical topic really, of maternal mental health. The knowledge and compassion that Elizabeth has for this topic is truly outstanding. She's presented on this topic multiple times at national conferences, and I feel really blessed to share her with the WellMind community. We all know pregnancy and birth are truly life-altering experiences. It brings change to roles, responsibilities, but also identity and relationships. There is, at least what I perceive, to be a good amount of focus on mom and baby from a physical health and wellness perspective, and there's lots of resources on helping moms and dads prepare for the arrival of baby, but a lot less attention is given to the shifts in identity and the impacts this experience of birth and becoming a mom has on emotional well-being. And if you're thinking that maternal mental health is a just for moms episode, I'm going to ask you to suspend that perspective and listen in, because this episode truly is for everyone. Moms, dads, those planning for and hoping to be parents in the future, anyone that knows and cares about a mom or a dad, and certainly all those in the church community that desire to support Christian parents. So please join me in welcoming Elizabeth DeBolt in episode 38, Maternal Mental Health. Elizabeth, welcome to the WellMind podcast. It is awesome to have you here. I've been looking forward to our conversation really since CAPS. We met for the first time down in Louisville, Kentucky, and at the Christian Association for Psychological Studies. And it was such a great conference. I really enjoyed that. And I think one of the best things that emerged from that was you and I getting connected and planning out our show for today.
Yes. Well, thank you so much for giving me the opportunity to talk about this, to talk about a topic that I think is incredibly relevant and really under discussed, a topic that often goes hidden. And so I'm very excited. Yes, it was a great opportunity how the Lord just orchestrated that. And thank you so much.
Yeah, for sure. This was a God designed thing because we were both at the conference. We were just like getting in line for food, I think,
Yes.
and we
Yeah.
just kind of struck up a conversation. And yeah, so you were one of the presenters actually at CAPS. I was just attending, kind of just hanging out. But you were there presenting on this topic of maternal mental health, and that just really sparked an interest for me. And we can get into why kind of that's important to me too.
Yeah.
But I think it would probably be good if before we dive too far into things, just to have you do a little introduction of yourself to our audience, to the WellMind community. Yeah, just give us a little peek behind the curtain. Who is Elizabeth, and what brings you to this topic?
Absolutely. Who is Elizabeth? That depends on the day, I feel like. But yeah, as you mentioned, Ben, I was presenting at the conference. This is the second time that I've presented at a CAPS conference, both times presenting on the topic of maternal mental health. The first time focusing more also on the ways that we can address mental health within the systems that are in place, including both counseling, obstetric situations, the ways that we can kind of bridge that gap for mothers. And then this time focusing more on maternal mental health and some of the disorders that accompany that time period. And I hate to use the word disorder, but some of the struggles, I feel like it's a more accurate way of describing it. And how those can range. I think there's one that gets the most spotlight. And I think that does an injustice in some ways as we talk about maternal mental health, into recognizing the holistic nature of what goes into maternal identity. But a little bit about me. So I've been in some form or fashion working with Liberty University for about the last probably 8 to 9 years. And that's looked from a variety of different aspects, from being on campus and having the roles of a researcher, performing research related to different topics, everything from adolescence to just a variety of different focuses. I taught as a TA and a GA at Liberty, and then just continued on that research focus. The Lord actually transitioned us, and I am able to now teach online with Liberty as an adjunct, and then continue doing research, which is kind of where my focus is right now.
That's fantastic. Yeah, I know that you and Liberty have had a interwoven history.
We're
as
married.
We've talked
We're just
about
married.
that. Yeah,
Yeah, it's all good.
yeah.
It's all good.
But it's been a really good space for you. It sounds like professionally to continue to explore and examine the areas that are important to you, and still, in another way, contribute to the growth and development of a lot of students that are going through the programming there.
Yeah, I've counted a real privilege. You always ask the Lord, I think, in different points of your life, where do you want me? Where can I glorify you most? Where do I see you opening doors? And God has continued to allow that to be Liberty. And so I do count it a privilege. Yeah, I'm very thankful.
Yeah, absolutely. So this topic of maternal mental health has been one that you've spent, a lot of time on, and presenting at a national conference like CAPS is a super neat privilege to be able to do something like that too. And knowing that you've been there twice to present, I think really speaks to just how important this topic is to you. So maybe we could start there and
Absolutely.
just share. What is it about maternal mental health that has really sparked this passion and interest for you?
Yeah, that's a great question. It was actually during my master's degree when I was working on counseling degree, and I took a women's counseling course. And I just was starting to look at the lifespan of women's mental health. And there was just a brief snippet, not a ton, but talking about what would be considered that perinatal period. So when we say that, we're looking at both that time frame that's encompassing pregnancy and that time postpartum. So kind of that holistic period of that transition into motherhood. And it was talking about some of the challenges, talking about some of the physiological challenges, but also mental health challenges and how those two relate. But it was such a brief snippet, I remember, in that course, as we're looking at the, more or less lifespan of a woman. And yet what stood out to me significantly was the fact, a vast majority of women do become mothers at some point in their life. And what a transitionary period this is. A transitionary period, which we can talk about in a minute, but just this whole identity is shifting and the dynamic changes that she's experiencing pretty much on every single level. It's just the whole idea that her whole life is changing. Her body's changing. Her responsibilities are changing. Psychosocially, she's changing. It just struck me as such a significant period in her lifespan. It's funny because, we spend a lot of time sometimes talking about adolescence and that period of life. And I know that, they're resolving a crisis of identity during that time. And yet you think about that period in a woman's life in which she's really resolving a crisis of identity with the responsibilities that are placed on her as a mother, with society's expectations, family's expectations, and the long-term effects that can have upon her child, her marital relationship or with a significant other, just her whole, more or less her whole life, her whole ecological system, how that can be affected by that one snippet, that one period of her life. And, research shows that some of these maternal mental health disorders that develop, prenatally and postpartum, we're talking years that they can affect her, and they can affect the bonding, the attachment, even just the cycle, even just the development cognitively of her child. So these have huge implications, and yet it felt like something we were just glossing over. Something that, they say once a mother, always a mother. And yet why do we not focus more on this period of her life, this transitionary period? So I kind of made that more or less my topic of research during my master's degree. I continued to pursue that then on into doctoral studies. And, I did an interesting shift, but I chose in between the PhD to get an EDS with the focus on curriculum and instruction. And my reason for that is that talking with those in social work, talking with those, talked with a great resource who teaches med students actually at Liberty's medical school. And it's just not discussed. Providers are not educated. Counseling students receive little.
True.
Yeah, no, I mean, I'm sure you can speak into this. It's just not a prime area that we specifically address. It's more of a cognate, a specialty. And yet you think about all these people that women are encountering and how if we could better educate the people in the system that are addressing these women, that are seeing these women on a daily, or seeing them, I shouldn't say daily, but on a more regular basis. Because it takes a lot for a woman to get into the counseling office. So while the clinical side is huge, what are all the factors that could preemptively help her in this transition? So I did. I chose to get an EDS so that I could understand how to write, how to teach, how to talk about these topics in a way that is informative and helpful and meaningful. And then you add to it the fact that I am a mother. At the time during my master's, I don't think children were even on the table. I think that we were.
I was going to ask about that because it sounds like this topic really predates you in the transition that you went through it to become a mother. So how did all of your research and studies and things, I guess, inform or influence your process when you first found out, hey, I'm expecting?
Yeah, that's a great question. And I had walked with other women through this process. I kind of had that bird's eye view, getting to see from the outside what they were experiencing. And, it's so different when you're not in it. I think it's a lot easier to recognize things, to point things out. And that's a topic that's huge as we even look at how we can help women. But just watching them kind of walk through this process of pregnancy and postpartum was fascinating to me. I also noticed there was just a lack there as well, on specifically to their emotional well-being. And then, like you said, the Lord blesses, we end up pregnant. I'm a mom to 3 now, but I end up pregnant for the first time. And it's funny, we always say that we can preach to everyone else, but it's really hard to look in the mirror and say it to ourselves. And so I think I knew all this, so I wasn't actually really focused on caring for this side of myself, because this is the first time I've ever had a baby. Like, what in the world? Like, what should I expect? How can I do this well? Like, pregnancy, how do I manage the professional side of my responsibilities while all the physiological of pregnancy? And then postpartum, what I noticed very quickly was the tangible reality of just that change in who I was. And I think for me, some of the emotions I experienced, while I am so thankful, I've never had, per se, a clinical diagnosis of anything. I think I could recognize symptoms that were areas that I needed to address, areas that could lead to maladaptive behavior, areas that emotionally I felt a huge shift. As a mother, I think isolation is such a key topic as we talk about this. I really felt that. And so the more I became a mother, and I say that in a weird sense, the more children I had, the more I realized, wow, this topic is so crucial within the church, within mental health arenas, within even just gynecological arenas. It's just so important. Yeah. And it's not talked about enough. I remember distinctively asking a mom that I knew, just a friend, and I asked her, and this was before I had babies, I said, how are you doing postpartum? And her gut reaction was, excuse me, I'm not depressed. And I was taken aback for a minute. We've done such a disservice to that fourth trimester that women walk through that even when we say words like postpartum, there's an automatic rebuttal. There's a buffering factor that takes place. There's a desire not to be associated with something that seems negative in association to their motherhood. So I think all of those things combined have really led me on this journey to make this such an important and just a meaningful topic in my life.
Yeah. Yeah. So let's just pause for a moment to just define maybe some of those words, because I, like you said, postpartum, there's like the definition of what that is, but then there's also the connotation or what kind of people's perception of it is. And you've used, prenatal, perinatal, those kind of things. So not to belabor that, but just so that we're all on the same page with what these things mean.
Yes.
Yeah. So could you walk through kind of maybe what you see as like really the essential terms that we need to know as we're discussing this topic?
Yeah, absolutely. Let's just walk through it from just a physiological standpoint. We're not going to look at some of the terms, just mental health related. But like when we say the word prenatal, most people know that that's going to be that time of pregnancy from initial, like the beginning of gestation until all the way up to birth. And then we have the word peripartum, which does play into some of the things that we could talk about as far as depression and as far as diagnosis. But if we're looking at this from an actual physiological standpoint, because it's used a little bit different when we look at diagnoses, but peripartum is going to encompass those first 4 weeks. So when you think about things that we could talk about like baby blues, that's kind of that peripartum period. It's a very unique time of healing, a unique time of transition. So that's kind of your peripartum period. A word that I like to use a lot is perinatal. And we briefly touched on it. And I like it because, that whole identity piece, that is starting in some ways before pregnancy, but specifically perinatal encompasses pregnancy all the way through that first year postpartum. And I don't want us to somehow think that after your 6-week appointment postpartum, that's it. You're done. You're healed or something, like you are this new person and you're ready to go with life. No, to recognize that it really is an extension well into that first year. So when I talk, I like to use that word a lot. And then also really as we focus on that period after birth, we say postpartum. There are other words that you can get into, but those are the key ones that you're going to hear.
Yeah. Those are the essential ones. Yeah. And I like that the peri, that kind of, that aspect of the word helps me because it really encompasses the whole process, both pregnancy and after birth. And that, of course, as a mental health counselor, you were pointing out peripartum. That's the new term, I guess, within the DSM model for diagnosis. I think it used to be postpartum depression, but now it is peripartum depression. And that's a recognition that mental health is happening and we needs to be attended to during the pregnancy too. It's not just after birth. And so I think while there's hopefully, more that we're going to talk about that can really expand our understanding of this, I think even that shift is helpful, because it's like, I know that women experience fluctuations in mood, stress, distress during pregnancy time as well. This isn't strictly like, oh, I've given birth and now my body is adjusting or something like that.
Yeah, and I agree. I completely, I applaud that change, because that is a more recent change, and it's a recognition of the fact, again, of the holistic nature and of the uniqueness that encompasses this time period of a woman's life, rather than just to call it a major depressive disorder. To be able to recognize that onset of it that's occurring, prenatally or postpartum. We won't get into my beefs about the time frame allotment of 4 weeks, but of onset of symptoms. But I do think that it's a great recognition that we're making strides in.
Yeah. And I mean, I tell my students this, and I talk about this with clients, like the DSM is an imperfect system. I mean, it's a system, it provides a structure, but it is what it is for now. And I'm sure that there will continue to be updates and changes as folks like you continue to help with the research and add to the literature.
Yeah, there's some great work being done by some organizations we can talk about later. But yeah, just lobbying for that recognition and just care that women need. But yeah, it's a great guideline. It's a good starting point.
Yeah. So I know that a lot of attention is paid to mom's physical health and just the whole physiological process of pregnancy and preparing for birth. There's classes and learning opportunities and practice, and spouses can be involved. And, there's a lot of attention that gets paid to that. And then also, I think there's a lot of attention of just like paying attention to what to expect when you're bringing a baby home for the first time, and just planning some of that out, knowing what's normal, those kind of things. But I don't know that we're paying a lot of attention to the mental health process. So how do you even begin that kind of a conversation with a mom about attending to or paying attention to their emotional health, their wellness from a mental health standpoint?
Yeah, no, it's great. And I would completely just recognize what you said is very valid. And having walked through it personally, I can attest that so much attention, a woman is going to be briefed throughout her pregnancy on everything from gestational diabetes to, early rupture of membranes of water, all these different physiological aspects. And I think it really depends on your practice. I'm seeing some great holistic care in more midwifery settings, more birth center settings. But you got to think too about when you're meeting with your OB, the time allotment they have with you usually is between 7 to 10 minutes. So they're really covering what they think are the most crucial topics. So it's not that I don't think that there's a lack of care there. It's just, a matter of priorities. And yet when you go to these classes, because we did, the birthing class, the breastfeeding class, all of these things, I cannot for once, and it's a topic that's important to me, so I would have remembered a discussion about maternal mental health, about emotions, about what to expect, what is normal, what is not normal, anything to prepare me for another topic too, but just those shifts, the dynamic hormone shifts that accompany a lot of these feelings and emotions during the prenatal and postpartum period. So as we're talking about this, there's so many things that I'd say would be great for us to be able to address and infiltrate and be able to change. But when we're looking to be helpful to someone who's around us, when we're looking to be helpful to a spouse, when we're looking to be helpful to a friend or as a church community, I think just recognizing who she is, not forgetting the mother in the process of this. There's so many times that we focus so much on the baby. That's the first thing. How is the baby? How are they sleeping? How are they eating? All these great questions, of course. course. But for a woman who this is her entire life right now, like she has not left the four walls within her home, like those questions are great. But again, we're completely neglecting the person who's caring for the baby. We're neglecting her well-being. We're neglecting the emotional shifts that she's adjusting to as she's incredibly sleep deprived and trying to meet the needs of this new human whom she's never met. So as we talk about this, I think one of the things I think is most crucial is just remembering the mom, remembering who she was, who she's becoming, the process of who she is. So I think the first thing to do is just to address her. Make sure that she's known, make sure that she's seen. And I think as we genuinely address the question of how are you, you change the intonation instead of just how are you, like how are you doing? How are you? Mm-hmm. And then you could fill in the blanks and ask those open-ended questions. But just as we start to break down some of those barriers, we just, I think, really need to get our focus and shift it back, because if you have a healthy mommy, you really do more than likely have a very healthy baby. So just shifting that focus is, I think, a huge first step. Hopefully that answered the question, maybe in a roundabout way.
No, I think that's a great place to start, because it's just about initiating the conversation. And so many times we don't even know how to start. We don't know, well, what, I don't want to, offend. Mm-hmm. I don't want to pry, but I want to be encouraging. I want to be supportive and recognizing, I do need to ask about this. But like you had pointed out, I think earlier, you said that you were talking with someone and you asked them how they were doing postpartum, and they had a reaction to that, right? And there was no ill intent, or there was no belief on your part that they were struggling. You were just asking, and at the same time, right? They took it a different way.
Yeah. No, and I think too, that's where, you can kind of, in communication, we talk a lot about, OIC, like observe, interpret, clarify. And I think sometimes it begins with just some simple observations, especially as those who are closest. I definitely don't want some random sweet lady in the church coming up being like, you got the bags under your eyes. I'm like, I'm very well aware of that. But, just those observations of those who are closest to her, which we can talk about in a bit, of just that's her safety net. That's her protective factor right there. And so those closest, being able to speak into that and recognizing to just that this is a normal transitionary period. So recognizing that she's going to have emotions, she's going to have experiences, but helping her keep open communication about those, especially with those closest to her, is so crucial to helping her be able to self-evaluate, helping in that self-evaluation, having, especially as a spouse, that person best. So I think those are important.
Yeah. So, and I do want to spend some focused time on the spouse part. Mm-hmm. And if it's okay, since it's come up, let's just go there now. I think I shared with you, my wife and I, we have 6 kids of our own. And, one of those pregnancies was a high risk pregnancy because we had twins. And so there were definitely times where it was like I was more like present at appointments because they were just very frequent, and then there were other times when I couldn't be present at appointments because it was like, well, somebody else has to watch the kids. Well, we can't both be gone and go to the appointment. So then it's like, well, how did things go? Or what did you find out? And, for me as a spouse, like I'm trying to navigate the responsibilities, to my wife, to my kids, and in those kind of things. So I'm wondering, in what ways can husbands approach their wives in a meaningful way when it comes to checking in and supporting her just emotional well-being during this time?
Yeah. Research has found that the greatest barrier to postpartum depression or maternal mental health disorders is that spousal relationship. The strength of it can be a key buffer and protective, On the flip side, when there's strain and there's stress, that's one of the largest contributing factors to maternal mental health disorders. So no pressure, dads, no pressure.
No pressure. Yeah.
But, like you said too, there's a difference sometimes between that first baby and, say, for like you, baby number 5 or 6, or for me, baby number 3. That's a dynamic too in and of itself as a mother, is experiences subsequent babies, and just that relationship, and how, it's going to look different from the first time that she walked through it to the third time. The interaction of that spouse is going to look different. I think that there's some things that are really important for him to remember too, especially as we talk about those beginning points postpartum. I'll jump back real quick to what you were saying about appointments prenatally. It's just being involved, being present as much as possible. Not making her, feel bad, but just letting her know, oh my goodness, it's a priority for me to take off to stay with our kids to make sure you get there. Helping her think through questions that she may have, or helping her identify things that she may need to discuss. I think that's huge, because, it's so hard when you feel like you're trying to have this dynamic of, balancing care for your wife, balancing care for your children. That creates a lot of stress, which is a whole other topic about, paternal depression, and how that's a real thing postpartum. But as we look at those beginning days after birth, there's a concept called primary maternal preoccupation. And this is a time period in the weeks following postpartum where the mother is just really identifying with that infant. She's really bonding with that infant. And it can be a time where she's increasingly sensitive. And I think the husband needs to be that buffer for her, especially during that time. And you talk about laying a framework. If he can be that for her during that time, she just experiences more or less thin skin. She can take criticism very easily. So recognizing, I hate to say it, but be careful with your words. Be careful with who you let in the home. Be careful with the interactions. You be that buffer to be able to say, no, like, we're done. We've had enough. Thank you for the visit. Or to recognize, I really think, let me care for the baby. I love you. I think some time to rest or just to go out for a walk would be helpful, or let's go on that together. Pursuing those needs that she has, and doing it in a way that shows love and concern. And you know your spouse best. Reaching out in their love language is key. Don't listen to what Elizabeth says, but do it based on your spouse's needs. But just recognizing that she is going to have a time where she needs support and care and protection. And that heightened state of maternal preoccupation is very real. It doesn't make her crazy. It doesn't make these weird symptoms that need to be addressed. No, it's very natural. It's very God-given. It's very important. So facilitating that in as calm and relaxed of a manner as possible is awesome. Super awesome.
Yeah. The word gentleness came to mind as you were describing that, of just like approaching any situation with a level of gentleness. I think is just the compassionate and kind way of going about it.
Yeah, absolutely. Yeah. And I think, that speaks volumes. Even babies as young as 1 month old are in tune to the emotions of their parents. So what a great foundation to build for your child too, as you set that foundation where they recognize that just in their closeness with you, that gentleness, that care, that's so important, especially as you're addressing just her well-being as well.
Yeah. So then, kind of shifting then back to focus on mom, what kind of things as a mom, as you're expecting and then during that postpartum period, like, how do you differentiate between what these normal fluctuations are,
sure,
and something that might be more significant that could warrant, like further discussion?
Sure.
Does that make sense?
Yes, absolutely. And I'm going to tag on to the beginning of that. Again, I just can't get past the fact of that whole concept of who she's changing and who she's becoming as she enters what is commonly referred to now as matrescence. Just a concept that an anthropologist brought about in the 60s of just becoming a mother, and recognizing she's shifting. Everything about her life is shifting. So recognizing that she is going to have emotional shifts and emotional stressors, and her friends might even change. Her support system might change. her responsibilities and even working and that whole life that she has built is going to change. So I think there needs to be a lot of grace that mothers give themselves as they recognize, wow, like I have this enormous God-given responsibility and it's beautiful, but it is hard. It is incredibly hard. And you add to it a whole milieu of the changes. Birth is one of the most dramatic hormonal changes that a woman will experience in her entire life. So just the dynamics of just physiologically what she's experiencing. You have deficiencies in every area that can affect how she's feeling. So recognizing that it's more than just a concept of I'm not good enough or I'm failing in this area. Just recognizing again that the woman is holistic. For her to see herself as a holistic person, I think is key. Now, when she's looking at things in her life that we kind of want to differentiate between absolutely normal part of motherhood and just a normal change, and then things that may be disconcerting or maladaptive, I think we want to look at the intensity. We want to look at the frequency, and we want to look at how it affects our day-to-day and our relationships with those around us, especially our baby, especially those that we're closest to. So I think you could take any, if you want to more or less, for a lack of a better word, say symptom, and discuss that. What's her reaction to a colicky baby, which is a risk factor for postpartum depression or anxiety as well. What's her reaction to that? Is it a sense of overwhelm that she cannot get past? Or is it a heightened sense in the moment that she then comes down off of and is able to process then through the next tasks of her day? So again, that the intensity is an incredible factor to look at. Is she having moments where she's having regret over having a baby? Totally normal. Completely normal. You're not a bad mom. You're not a failure. This is not the trajectory of what it's going to look like for the next decades. But recognizing that's normal, that's okay. But is that persistent? If you're continuing to feel that, if you're continuing to have a topic that is not given a lot of attention is rage. Mothers have postpartum rage, just an anger that's lashing out, that's frequent, that feels uncontrollable, that even maybe sparks fear. It's fascinating. A research study, I believe it was done by Yale, noticed that in mothers directly following birth, the sound of their baby's cry actually activated portions of their brain that's associated with OCD, that's prone to lighting up, more or less, if you want to look at it that way, in response to OCD characteristics. However, completely normal. These were healthy women with no mental health disorders, but just that natural response to her baby. But when does it become something that keeps you up at night, that you can't sleep, that causes physiological issues, gastrointestinal issues? That's something that we'll see too. Just all these things that I think a woman at a certain point realizes this is becoming a prominent part of my life and not in a helpful way. So yeah.
And there's so many good things for us to unpack with what you were talking about there that I do want to circle back to.
Yeah.
But what I'm hearing in this moment too is recognizing that, like all things, mental health, it's on a continuum.
Yeah. Oh yeah.
And so when you're talking about the level of intensity for some of these things, it's not that, oh, I had this thought of regret or something like that, and now, oh, that means something bad is happening. No, that's normal. We can normalize that. And it's recognizing that if that thought is persistent and I'm not able to move away from it, I'm not able to challenge that thought, I find myself kind of buying into it or believing
dwelling
that,
on it.
Dwelling, perseverating on it. Okay, now we've kind of moved outside of like, oh, this is normal fluctuations, to something that is more maladaptive or could be a cause for additional distress. So I need to address that maybe in a more specific way. So there are lots of good examples that you gave there of that spectrum or continuum. But the thing that I do want to circle back to, really what you're talking about, is this shift in identity that happens. And anytime identity is changing, adjusting, growing, whatever the case may be, like there's there's a lot of distress that can come along with that, a lot of questioning and wondering. You kind of pointed out like adolescence is a big time for identity development.
Yeah.
And we kind of, I think, are able to get our heads around that a little bit more because everybody goes through adolescence, but not everybody goes through pregnancy and becoming a mom. So
Correct.
yeah, and it's unique to a person. So yeah, I do want to unpack that a little bit more when you're talking about some of the identity shifts that moms are experiencing. If you could just speak to that a bit more, I'd really appreciate it.
Yeah, absolutely. And yeah, I think this is such a topic that we forget in this discussion. So I know I've probably mentioned it a lot, but let's just again dive into it. And I think too, we need to realize that this is going to look different based upon the way that this woman became a mother. There's some identity shifts that are unique to even IVF. They're unique to that process. Adoption. That's a whole different process, a whole different shifting, because you do think about it. Prenatally is a time of identity shift. In some ways, it's a preparation. It's kind of the expectant of what's to come. And sometimes women, while they have that expectation, the adoption process can happen very rapidly or very quickly. And so even that's a difference in how they process who they are as a mother, and even in that unique bringing in this child into your life. So just to recognize that, I don't want to disregard that if we have women that are listening. But yeah, as we're looking at the identity shift component, circling back to the concept of becoming a mother, that was discussed by Mercer. And that was this whole concept that this reorientation of a woman's life, but really coming to a point of what's called maternal attainment. And I'm so glad that in some ways we have this to be a framework, but I'm glad we've moved past it because just in research and study, maternal attainment, I would be hard pressed to see somebody who ever finally reaches that level of attainment. I think her whole mentality behind that is that at some point you become comfortable in adopting this new role. And that's huge. That's incredibly important. But talking with people who have adult children, obviously my oldest is 6. I have no grounds to speak here, but they say, that's a whole new level of parenting, a whole new level of persona of even who you are now as their parent. But as far as we're looking at this maternal identity shift, building off of Mercer's theory, we have Rubin, and then we have many who have, and then probably the last 10 years really brought this topic back to the forefront. But Rubin was the one who's an anthropologist who just noticed how much a woman's life affected every level. You think about anthropology and the purpose of what we're studying, just her culture, her circles, her social circles, her professional circles, how all of that affects who she is. And you think about all those shifts, I'm sure moms right now are thinking, oh yeah, this has changed my ability to go out anytime and meet with people, my ability to meet deadlines. Think about it prenatally. I still remember somebody asking me when I was in a grad course, and they were pretty much just more or less like, are you sure you should be taking this right now? You're pregnant. I'm like, of course I'm sure I should be taking this, as I rush out about 6 times to go, have morning sickness and vomit, all these things. I'm like, oh, now I'm questioning, am I cut out for this? Again, man, what a cycle women can get into during this process. But you look at that whole prenatally time, she's kind of preparing mentally. And then unlike adolescence, where you have years to walk through this process, she in 9 months is thrusted into motherhood. She's thrusted into this whole matrescence, becoming a mother. And again, just the social stressors, the physical, the emotional that accompany even the process of childbirth, that can really even set a tone for, just that development of who she is as a mother. So again, as we talk about matrescence, people might find it helpful to reference people like Raphael and Athen, O'Reilly. They've done a lot of great work. And again, recognizing the validity of you really are shifting. You really are taking on this new role, this new identity, a very dynamic identity. And that sometimes there's even a mourning of what was, of who she was as she processes who she's becoming. So again, that's why matrescence is such a great word to use, just the becoming of a mother and how that is such a process, a continual process.
Yeah. Yeah. You, I think, had talked about just approaching that change process or this growth process with grace, and being understanding, being patient with yourself. I'm wondering about ways in which moms can go about like intentionally thinking about or kind of focusing on some of the shifts that they're experiencing with their identity. How, like, it's happening,
Mm-hmm.
but I guess a common theme within the well mind is like, how do I bring intention to this thing, this topic that we're talking about, whatever it is, so that I can uh, cultivate my
Mm-hmm.
wellness while going through, whatever it is. And in this case, these identity shifts. So what are your thoughts on, how to bring intention to this process?
Absolutely. I think back to just showing grace to yourself, something that a lot of women will say was that motherhood brings about a whole new side of empathy, empathy for others, empathy for their child. I think just being empathetic and recognizing in our own life, like we need grace. We need to recognize that we have these feelings and they're not wrong. But I think intentionally addressing, some people will plan, oh, this is what my maternity leave is going to look like. You kind of make a plan. I think if you can almost in your mind make a plan, knowing that plans are fluid and flexible and often have to change, but to be able to talk through that, like, what do the first few weeks look like for me? What do I want them to look like? Do I think it's going to be important to surround myself with people that have been very important in this process? Or do I think just knowing my nature and my personality, this will be a time that I need to be more alone. I need to be left with, more my spouse, and making plans for that. I think recognizing, reading books, talking to women who have walked through the process, that it's okay that if you have a different viewpoint on returning to work, it doesn't make you bad or good. Recognizing that your goals will shift. I think that's it too. Like, as we talk about goals, lots of women have goals for the actual physical portion of delivery and labor, but setting some goals for yourself postpartum, during the pregnancy period. What is something that's meaningful to you now? How do you incorporate that still into postpartum life? Because if you're not careful, life can very quickly become all about that baby. My sweet second, who is by far my one who is making me the most like Jesus, is what we'll say. Things were just, it was such a hard time with her that I remember I did not even get my 6-week appointment until about 7 months postpartum. Because it never worked out. There wasn't a plan in place. I thought the plan would happen. Things kept falling through. There was always something that was more pressing, always something that's more pressing. So I think if you can look at it ahead of time and say, this is part of who I am that I love, that I don't want to go away, whether that's you participate in physical exercise, whether that's you're part of a book club, I don't care. It's important to you, and maintaining some of your identity in that way. And knowing that it's okay if it pauses for a time, but don't feel like that has to be erased. That's still part of who you are. So I think really just that setting your priorities, setting the things that help define who you are right now and who you want to be part of your motherhood is incredibly helpful.
Mm-hmm. Yeah, I love that. I do. I mean, it makes so much sense as I'm listening to you say it. Like, it's like, well, of course, yeah. I mean, that is a way of retaining aspects of your identity that are of tremendous value to you. That you would plan that out. That you would plan to continue to engage or participate or connect with those meaningful aspects of self, because when we don't do that, I mean, this is universal.
Right.
Like when we get stressed, the
Right.
first thing to go is attending to our own wellness and self-care, right?
Yeah.
And
Absolutely.
so much of identity is wrapped up in that. And so then there can be this sense of loss, and even resentment for, it's like, well, now I don't get to do these things. And I think then that fosters a maladaptive process through these identity shifts. So I love that. I love that way of bringing intention and planning out those critical aspects of self, and how is this going to look, and it's going to look different. And that's where the flexibility comes in, right?
Yes. Yes.
It's not going to be the same,
Right.
but it can still exist here.
Right. It can still exist. And there doesn't need to be guilt. Something that's really prevalent too that we're finding with millennial moms and Gen Z moms is there's this extreme feeling of always being on, always being present for your child, for your family. And obviously there are biblical roots to wanting to obviously serve your family and to serve them well. But this pressure that we put on ourselves to the neglect of oneself, like what you were saying about stress, that society almost applauds. You have almost the mommy martyrdom symptoms going on of just such neglect for yourself that you don't retain yourself in the process. You don't retain who you are and who the unique person God has made you and the unique giftings that God has equipped you with, and that are just an innate part of who you are as a mother, and that actually help you better mother, if that makes sense. So yeah.
Yeah. I love that. And I think, I like when I think about this as a husband and as a father, like that's important too. Like that's another way that dads can be supportive of husbands, being supportive of their wives, is to like encourage that. You know your partner, what's important to her. And so not waiting for her to ask for that, but to be an encourager of it and say, hey, I noticed like you haven't painted in a while. Why don't you take some time if that's something that's important? I'm just kind of pulling that out, but I want you to go and do that. Let's set a time this week where that's just for you,
Right.
and you can go and do that thing. I think that's another, hopefully, a way that spouses can support one another.
Yes. Yeah. And facilitating that is so huge. I joke with my husband sometimes. I'm like, it's just too much work to go on a date because I have to get the house clean. I have to get the dinner prepared. Like I'm exhausted by the time the date comes. Like I'm like, oh, okay, here we go, type of thing. And I say that jokingly. My husband does a million things for our family. But the whole point of facilitating is huge, and not doing it in a, you haven't done this, so I'm going to make it so you can. Not a negative, but a sense of like, you just love painting it. It's so beautiful when you get to participate in that. And so if it's okay with you, I've already arranged where I'm going to take off a little bit early from work. There's a place that I've, booked that you can go and do that. Just really instilling that in such a scenario where you are showing gentleness and just concern and just genuine love for your spouse. Because, she's going to come up with reasons. Again, as a mother, that responsibility factor not to do it, but to just package it in such a way that you recognize that's a beautiful part of who she is. You're so excited for that to continue on. I've made it possible. Go enjoy, type of thing. It's a lot easier to be like, oh, yes, thank you so much. And 9 out of 10 times, I bet she's going to come back, and it's just going to be so healing for just the wellness of that relationship with your child and the marital relationship itself.
Yeah. And I appreciate that too, of like making it a positive, of just a way of showing love, really, to your spouse. So I think a beautiful way of approaching that, for sure. So I'm wondering, we've talked a little bit about kind of these really close personal relationships, but I think the kind of the micro communities that people are in too. We've talked a little bit about like our church community and what a wonderful place of support and encouragement that can be. But in what ways can our faith communities, our churches, be attuned to or supportive of maternal mental health, and just recognizing that, that I think there's a beautiful overlap in mission there, that churches can serve moms in this way. So I don't know. What are your thoughts there?
Yeah, I think one of the big ways I think is obviously just peer groups in general, recognizing that, yes, having a baby is often blissful, but sometimes it can feel really burdensome. So I think just being aware that as much as we want to frame this in a positive packaging, more or less, and approach it in such a joyful time, it's not always like that, and to not impose upon the mom that it is. I think in our conversations, of course, being excited, but again, observation, just listening, making yourself available. I think one of the things I learned quickly with my first was, as a church, and I say this in the best of ways, we can be so great to show up in the moment, showing up with a meal. I mean, I'm in the South here. I'm in the Atlanta area. So, I mean, if you get a casserole, that's the way we should love here. Lots and lots of casseroles and lots of sugar. But at a certain point, yes, meeting physical needs is huge, so important. Offering to care for a baby while the mother gets rest. Obviously, those are just well-known things that we can do. But being present as time passes is huge too. I said my middle child, she did not sleep once until 8 months. I did not get a full night's rest until 8 months. You talk about some stress. You talk about some discouragement. You talk about just feeling inadequate. Lots of feelings there. But, at that point, 4 weeks has passed postpartum, and a lot of that support drains. Not ill-intentionally at all, but just recognizing, again, what did we say? The perinatal period is a year. We love to walk we love to walk alongside parents during the adolescent stage. We love to be that support system or sounding board. Moms of new babies need that too. They need that for the longevity, not just your advice on teething ointment, but really just a listening ear and an observing eye, an eye that can support, hey, yeah, you have a 6-month-old, but you still may not be getting good sleep. Could I bring you a meal at that point and sit and chat? Could I just do anything around the house? Or I would like to, that's another great thing to say. I would like to do such and such. May I do that? Instead of, what do you need? Well, mom doesn't half the time know what she needs. It's a terrible question. You're often going to get that I'm fine. And again, that's just perpetuating the issue. So really, as the church, it's showing up long-term and not just, not only physically, but spiritually as well, just caring for the well-being of that family, that couple, offering them date nights, offering to be present, offering to give them time to connect. Because again, what's the greatest buffer? That marital relationship. So facilitating that for them to keep them in a well space. Just some thoughts.
Yeah, no, that's beautiful. No, and food is the love language in the Midwest too. It's hot dish up here. Hot dish,
okay.
Course, but
yes, casserole, crock pot meal, it's the things you're getting down here.
Yeah, no, for sure. And that's, just thinking long term, because in the immediate moment, everybody's paying attention, everybody's thinking about that because it's a celebration, right? And people like to celebrate. Right. But what we're talking about is really sustained support, being, brothers and sisters with one another, and continuing to attend to one another as a church community. And so I appreciate those words of encouragement. And I like that. I would like to, because you're absolutely right. What do you need? Nobody wants to feel like a burden to others or like, oh, I'm asking you for something. But when something is offered, it just makes an easier yes. Like, sure, that would be wonderful, to accept that with grace and appreciation for sure.
Yeah, absolutely.
So I'm wondering, you said, I think early on, it's hard to get moms into the counseling room, right?
Yeah.
And so much of what we've talked about really, I think, supports, resilience, supports the protective factors like you were talking about, like good self-monitoring, checking in with yourself, having your spouse checking in with you, really supporting, normalizing a lot of these things. But and then we have the real needs where mental health has been diminished and maybe professional services are warranted. I know that when I worked for the hospital system as a counselor, this idea of integrated care was something that was still being developed. I mean, it was present in some locations where there might be a counselor on staff at an outpatient clinic or something like that, but that wasn't universal. And I don't think that it is now. So how do we, from just a a person level, like break down some of the barriers that might be present for people seeking out supportive help and through professional services.
Yeah, absolutely. I think it's important to remember that as we talk about maternal mental health, it is actually the most common complication following childbirth. And I think that's incredibly freeing to recognize. Wow, we hear so much about, all of the physiological, all the things that you might experience postpartum. I mean, you get a whole pamphlet on it. Your spouse knows, not to massage the place in your leg if it hurts, like all these things that, like steps to take, action steps to take. And yet there's not a ton of recognition or action steps provided to mothers to prepare them, to let them know ahead of time of what to expect. So I think to break down some of those barriers so that women feel more comfortable seeking out help if they're noticing things that are concerning, things that are lingering, is first recognizing it is, I don't want to make it so common in the sense that we pass it off, but recognizing this is a very common, and I like to say complication of just having a baby, of experiencing motherhood. So I think as much as we can normalize the fact that this does occur and that it is very treatable. I don't know any woman who would go around with a physiological ailment following birth that wouldn't at some point reach out for help. There's no reason to live that way, right?
Right.
So why should it be any different with our mental health? So recognizing that, I think, is key. I think that also, as we talk about this topic, recognizing that there should not be a sense of shame or guilt, that stigmatization that somehow you're less than, somehow you're not meeting a standard or an expectation if you have these thoughts or these struggles, or you're lacking maybe feelings towards your infant. That is not an area of weakness. It's not a perception on who you are. Again, that identity component. It could be a variety of reasons. Again, a whole nother topic, but just the shifts that she's experiencing hormonally, like that could be a very easy part that you meet with your OB and you address that and you find that, okay, let's get you on a level ground before you start doing this uphill battle. Like no reason to run uphill. Let's just get you on level ground here. And sometimes reaching out to your OB is a great step to do that if you're experiencing any physical or psychological symptoms. But I will say too that, like, back to that component, I don't want to make a blanket statement. Some are very well equipped, others are not. A survey was done, and a lot of, I hate to say this, but one OB said in a case study, I just don't have the skills or the abilities to meet that need, so it's easier not to address it. And that made me want to just, my eyes got so big, I think I hurt. But the fact of, they are seeing so many women that to provide individualized care really does need to be passed off to a counselor, to a therapist who can help. So recognizing that there's no shame or guilt in discussing this with your OB, with your spouse, with someone that's close to you. Again, it's not a reflection on you, not to have fear. A lot of women have this fear of, what are they going to do? What's going to be the action steps? Am I going to be penalized? Am I going to be, women even think, could I lose my baby, type of thing. And that is not where mental health professionals are coming from. And you can speak into that 10 times more. But that's not what the action step is going to be when you meet with someone. The action step is focused on getting you well so you care well for your baby. And then just a lack of disclosure, again, that stigmatization, not wanting, I think it was nearly 6 out of 10 women screening positive on the EPDS, which is a scale for screening for postpartum depression, had not spoken to a healthcare professional about their symptoms or concerns. 6 out of 10 that screened positive, like, we just need to not have a fear of disclosure, of letting that be known. So then again, just as far as knowing that it's treatable, knowing that you can get help, knowing that there are people out there who this is their passion, is to help see you well. And there are different methods that they can use for that, different opportunities and different avenues for that as well.
Yeah. Yeah. Back to kind of my professional experience, I always felt very privileged in working with a new mom. Some of the referrals that I would get were either from a person's OB. Sometimes it would be from the neonatal intensive care unit, the NICU. Obviously, that's a really high stress
Yeah.
time. And so I think they're a little bit more alerted, I guess, or kind of cognizant of that, because trauma can happen as part of that process as well. And so I definitely got to work with some moms, some married couples as well that were going through that. And then other times it came actually through the employee assistance program at the person's office of employment or their spouse's employment. And so they had this opportunity for some free
That's
counseling
great.
services. And it's an easy call. It's like, hey, I'd like to come in and visit with somebody. And a lot of that happens through telehealth now too. A lot of, so it's super easy to connect where moms don't have to because I did have some, they're bringing baby with them,
Yeah.
and so we're sitting in the counseling session and I'm even saying, hey, do you want me to hold her for a little while? And I get to hold
Yeah.
baby while we're visiting.
Yes.
And, it's just, those were really special
Yes.
times for me in my clinical practice and in working with those new moms and working with couples with a new baby. So I see that as an incredibly positive and productive space for people to be able to step into. And so that's kind of my encouragement too, just on the provider side, to be able to contribute in that way is really, really meaningful.
Yeah, I mean, if you think about it from the provider side, you're investing in a legacy right there. And I think that's huge what you were saying too about the components of being very open to letting a mom feel welcome to attend to her baby during those counseling sessions, creating an environment where she feels comfortable, even facilitate time where if you need to pause to let her nurse or feed the baby, that's very important, not making her feel like this is an additional burden to her wellness. So I think those are huge, facilitating that's known up front, because that childcare, lack of transportation, those are huge issues that prevent women from getting in an office. And then, like you said, telehealth, depending on, the severity of where a woman's at, there's great things like group counseling that's available online, and you can get plugged into those local groups. But yeah, telehealth does break down a lot of barriers, but goodness, I am an old school person here. As much as possible, I think that, just that facilitating of a relationship when you can somehow meet in some form or another, just face to face, is so helpful. Because there's a lot that, you and I, as we do this, we can see each other, but gosh, there's so much more to being in a room, to being able to have those conversations, to see her dynamics with her child, and to be able to even address that from a clinical standpoint is immensely helpful. But yeah, so many great options. And by God's grace, technology does help us with that a lot.
For sure. For sure. And what about, I guess this is kind of the resource part of our conversation too, because I think then there's a bridge between this of okay, I'm listening to this conversation. This feels important to me and in my season or in the season of life that a loved one is in or somebody that I care about. If I want to grow my own knowledge, or if I want to access maybe some just informal support services, what do you see as maybe kind of reputable or really constructive, informal resources that people can access?
Yeah, absolutely. And I think this is so, again, a blessing of technology, because how many women are going to find themselves at 11 o'clock at night, not able to reach out to a person? But the internet does provide us with a lot of great resources that can guide us, that can point us in the right direction and facilitate the help that we need. So one that I always come back to is just called Postpartum Support International, PSI.
Okay.
It is a treasure chest of just information. You've got everything from online group supports. You've got where you can actually chat in a weekly call with a PSI expert regarding things that you might be having as far as symptoms, resources, treatment. That can be a first line of recognizing disclosure that feels safe. There's some anonymity there. You even can find a provider through that resource. They even have just a helpline, just a confidential helpline. And then they have all kinds of other things as far as, blogs, overviews. Maybe you want to go into finding a little bit more about the symptoms, which we didn't even have a chance to talk about, just, some of the specifics of that.
Mm-hmm.
But you can just kind of look over these, like, do I feel like I am struggling more with anxiety, which is a very prevalent topic and often actually misdiagnosed as depression, which shouldn't be. But you can kind of read through some of these things on your own and do some self-assessment. But then also, and then this is a great one too that I love for providers. They provide training, they provide continuing education credits. They even have a conference. It's probably my first line as far as resources.
Yeah, that sounds amazing.
It's great. It's really great.
Yeah. And I'm totally, some of the maybe authors that you referenced earlier, and certainly this website, those kind of things, I'm going to link in the show notes for this episode.
Perfect.
So after, folks are done listening, check out those links, go to those websites, those kind of things.
Yeah, definitely make sure that you, take a screenshot, you bookmark them, a few others that we can then link to, but just postpartum progress. This one, I love it because it's not as professional in some ways. It's very much from a woman who's kind of walked through this and then gathered all these professional resources. So it's a little bit, the website almost feels homey, if that makes sense when you look at it.
Yeah, no, it does.
So I love Postpartum Progress. The Blue Dot Project is another that we'll link, that also provides testimonials. Man, to hear somebody else's voice can be so helpful and be like, they've walked through it too. Like, I'm not alone. That is their own words and their own experiences. Oh, that can be hugely impactful. And then there are several others that we can just talk about, like you said, just in the notes, that may provide, beneficial reading, even for some providers. Massachusetts General Hospital, they have a women's mental health. They have incredible articles, just some innovative research too on this topic. So.
Yeah, no, that's great. Yeah. And I mean, you're right, because I think, providers in the medical field they're just, their schedule is so full. Mm-hmm. It's really hard for them to attend to these things. I know that within mental health counseling, even marriage and family therapy training, like this topic of maternal mental health, it just gets, touched on. Mm-hmm. Really. And unless you take like a specific class, like you were talking about, like counseling women or something like that, where it is a zeroed in focus on a particular topic for a period of time, I think, it doesn't have to be a specialty, right? Because I think lots of people can provide this kind of care and do a good job at it, but it just takes a little extra time and attention to focus on getting the understanding and competencies for it, because you're absolutely right. Depression and anxiety can look super similar, but they are distinct, mm-hmm. and it's important to distinguish those so that the person's getting the best treatment possible.
Yeah, it's so important. And just like you said, as professionals, like even I know that you've worked with a lot of children in your practice, and noting mm-hmm. so many, I don't even want to say issues, but so many struggles that children have that actually relate back to the issues that mom has struggled through. So being able to, again, address this preemptively, I mean, we could do a world of good as we look at mental health. Even just the rate of adolescents I believe, I don't have the exact statistic, but it's that they are at about 4% or 4 times higher rate of depression during adolescence if their mother had depression. So just recognizing, like, again, you don't have to be specially trained, but as we seek to love others with the love of Christ, that includes giving of ourselves to find time to educate ourselves well, with quality resources and steps that we can use to apply to help these women, to help these moms.
Yep, absolutely. Elizabeth, it has been so much fun getting to catch up and visit with you
again.
It was a privilege to get to meet you at the conference and doing this podcast. I just feel really blessed to be able to have this time with you.
Thank you so much. It has been such a pleasure, and I'm so thankful for it.
A huge thanks to Elizabeth for joining me in the WellMind community. We appreciate your insights. Many thanks to all of you for spending your time with me today. If you enjoyed our conversation, please check out previous episodes, click rate and subscribe through your podcast app, and just generally let people know about the WellMind. Maybe share this episode with someone you think might enjoy giving it a listen. Be sure to check out the links in the show notes for all the resources and information Elizabeth referenced during our discussion. Many thanks to the staff, specifically Alex, here in the Bethany Lutheran College podcast studio. I appreciate all that you do in support of the Well Mind. Thanks again for listening, and until next time, be well.